I think one of my biggest concerns of the patients that I see is how many patients end up coming back to the ER after they have been discharged from the hospital, or those that use the ER as a primary care facility that just don't know where else to go for their medical needs. My role within that environment is to make sure that those patients get the medications they need, but also that they're using them correctly so that we can make sure that their hospital stay is as short as possible, and that we can optimize the therapy that they're getting so that they get not just the right drug, but they're getting the right dose, and that we're making sure that it's not interacting with something else that they're taking. I think one case that kind of comes to mind that I know has happened in hospitals all across the country is making sure that patient gets the right medication for what they're being treated for. We had a patient one time that came in with a pretty severe urinary tract infection, and the medication the doctor ordered was something that wouldn't work for that particular infection. It's something that wouldn't treat a urinary tract infection, and in consulting with the doctor, we switched it to something else, and basically ended up making the patient's hospital stay 48 hours or less when, had she been started on the original drug that was ordered, could have led to something more severe, and she'd have been in the hospital 5-6 days if she even made it out of the hospital from being treated incorrectly. I see everything from gunshot wounds and being on the front line, making sure that patients are getting the right stuff for the indication as to why they're there. You get patients coming in from car accidents. It's being able to think on your feet, and when physicians are focusing on the broken bones or making sure that bleeding is controlled because of where the bullet is sitting, I'm there to make sure that the patient is getting the right drug, to make sure that they're being managed, to make sure that they're comfortable, that they have their pain medication for that broken leg that they have, while the physician is worrying about the other problem. I'm there to make sure that the patient is being taken care of from a medication perspective. We get patients that have chronic medical conditions and are on 20 to 30 different prescription medications, and what do you start for that new infection that the patient has, or how do you treat their blood pressure that's out of control when they're already on 3 or 4 different blood pressure agents. I work right with the physicians and the nurses to make sure that the patient is being taken care of while they're there, and hopefully they get to go home from the emergency department, but if they get admitted to the hospital, it's taking a look at their medicines and making sure that nothing's going to interact and that they're being treated appropriately. It's not just about giving them the right medication, it's about giving them the right dose and making sure that it's being used appropriately so that they don't end up with other complications as a result of it.